Hi guys and girls, so I thought I'd do a little update. Those of you that follow my channel know that I do an update every now and again since my hair transplant in December of 2018. It's now just coming up to July 2019, so it's just been over 6 months since my transplant and it seems to be doing okay. I'm very happy with it. Even the crown seems to be thickening now, so it's all good news. I get quite a few questions, so I thought I'd do a video for hair loss for women and hair transplants for women because it's becoming more and more common, the same as it is for guys. A few years back people didn't have as many hair transplants as they do now. It's becoming more of a common thing now, and some guys are still frightened to tell people that they're having a hair transplant. They're frightened to tell their work colleagues. You know, I think you shouldn't be frightened of that. Tell them, you know, you're doing something to improve your appearance. You're doing something positive for you. I get a lot of people saying, you know, after watching videos, they're now going through with it. So it's good. But yeah, I get quite a few questions every month, and I get quite a few from women just recently asking about hair loss and hair transplants. So first of all, I'm not a doctor. I'm just a regular guy that's just had his hair transplanted last year in December. And as I'm not a doctor, just sort of bear that in mind. I can only speak about my experience really. So just if you've got any hair loss questions, that you should go and visit your doctor or a dermatologist, especially if you know you've started losing hair very quickly, because it could be something completely different. You hear a lot about male pattern baldness, which is where guys are going bald and sort of can run in the family. So I've been looking up on the internet about female baldness, and I've been reading up about it, and there is a thing called female pattern baldness as well. So yeah, it's a thing the same as male pattern baldness, and I'll read you some of the things I found. So it's female pattern hair loss is called androgenetic alopecia. It's basically the most common type of alopecia in women, and the severity can vary. What causes it? Female pattern hair loss is caused by a combination of genetic and hormonal factors. The hairs produced by the affected follicles become progressively smaller in diameter, shorter in length and lighter in colour, until eventually the follicles shrink completely and stop producing hair. So it's similar to guys. Female pattern hair loss can be associated with conditions in which androgen, a group of hormones, levels are elevated, such as polycystic ovarian syndrome, acne, increased facial hair, irregular periods and infertility are all signs of PCOS. Right, is female pattern hair loss hereditary? Some long words here. Yes, it is believed that it can be inherited from either or both parents. What are the symptoms? In women, the age of onset is later compared to male pattern hair loss, usually occurring in the 50s or 60s. Occasionally, female pattern hair loss in women may start earlier than this, either in the 30s or 40s. It's not usually associated with scalp symptoms. Hair loss can, however, cause psychological consequences and have an impact on the quality of your life, same as it can for guys. You know, a lot of guys become more confident once they've got their hair back, and baldness can sort of make you shy. It can really affect you psychologically. What does female pattern hair loss look like? Pattern hair loss looks different in males and females. In females, there is a widespread thinning of the hair, mainly on the crown or the scalp. The hairline at the front of the scalp often remains normal, whereas with guys, it starts receding at the front and you get the bald spot at the back, and then as it gets worse, they kind of join up in the middle. Hairs in the affected area are initially thinner, smaller in diameter and shorter compared to hairs in unaffected areas before they become absent. How is it diagnosed? The diagnosis is usually based on the history of gradual thinning of hair or increased shedding on the top of the head, the pattern of hair loss and any family history or similar hair loss. The skin on the scalp looks normal. Occasionally blood tests may be carried out. Can it be cured? No, there is no known cure for pattern hair loss. However, it tends to progress very slowly from several years to decades. An earlier age of onset may lead to quicker progression. How can it be treated? Topical and oral treatments. Applying 2 or 5% minoxidil solution to the scalp every day may help slow down the progression and partially restore hair in some women. Only the 2% strength is licensed for women, but it is not available under the NHS. The 5% solution can be used under the advice of a doctor, but is not available again on NHS. It says and is expensive, but you can buy that on Amazon. Minoxidil solution should be applied to the affected scalp, not the hair, using a dropper or pump spray, and should be spread over the affected area lightly. It does not need to be massaged in. Minoxidil can cause skin reactions such as dryness, redness, scaling and itchiness at the site of application. Should not be applied if there are cuts or open wounds because it stings. Minoxidil should only be applied to the scalp. Any spillage to the forehead or cheeks should be cleaned to avoid hair growth in the area. Minoxidil should be used for at least 6 months before any benefit may be noted. Any benefit will only be maintained for as long as the treatment is used. It may cause initial hair fall in the first 2 to 8 weeks of treatment, and this usually subsides when the new hairs start to grow. Oral treatments such as spironolactone, cyproterone acetate, flutamide and cimetidine can block the action of dihydrotestosterone, I think that's just DHT, a hormone on the scalp, which may lead to some improvement in the hair loss. These treatments are not licensed for use in female pattern hair loss. Spironolactone and cyproterone acetate should be avoided in pregnancy since they can cause feminization of a male fetus. Both should be avoided during breastfeeding. Flutamine carries a risk of damaging the liver. It's important to note that all of these topical and oral treatments only work for as long as the treatment is continued. So what else can you do? It then goes on to mention wigs and hair pieces. Some affected individuals find wigs, toupees and even hair extensions, I think they're called hair systems now rather than wigs, helpful in disguising your female pattern hair loss. There are 2 types of prestige false hairpiece available to individuals. These can either be synthetic or made from real hair. Generally, only synthetic wigs are available under NHS, which for those that aren't in the UK, NHS is our health system where you pay your national insurance and then you can get pills and things like that on the NHS. Synthetic wigs and hairpieces usually last about 6 to 9 months and are easy to wash and maintain, but can be susceptible to heat damage and may be hot to wear. Real hair wigs or hairpieces can look more natural, can be styled with low heat and are cooler to wear. You can also get skin camouflage. Spray preparations containing small pigmented fibres are available from the internet and may help to disguise the condition in some individuals. These preparations, however, may wash away if the hair gets wet, rain, swimming or sweat, and they only tend to last between brushing and shampooing. I think this is similar to fibres, which I think are amazing. Before I had my hair transplant, I used fibres almost every day. They cover bald spots, they're brilliant. All of the products that I've used myself or that I'm thinking of buying, I'll put in a link below. I'll put it as the first comment, I'll pin it. And I'll also put it in the description. I've got my own Amazon page. I buy things off of Amazon. A, they're pretty good price. B, I've got a locker near my house so I don't have to be in when they deliver the parcel. I just go and pick it up from the locker. But all the things I take I'll put in my Amazon page and I'll put it below. Right, surgical treatment is not offered under the NHS, i.e. a hair transplant. This can be sought privately. Hair transplantation is a procedure where the hair follicles are taken from the back and sides of the scalp and transplanted onto bald areas. So this is where I had my hair transplant, and yeah, they take it from the sides at the top and the back at the top. And for a woman, you probably have FUE or DHI. They take them out, and I've heard some women are frightened about do you have to have your hair shaved? No, you don't. You can ask them not to shave it and they'll pin your hair back. I've seen some women recently that have had it done and they've had, their hair tied back while they're doing the operation. There's a drug that guys take called Finasteride, or some guys take. I personally don't, because they don't allow it if you give blood, and I give blood regularly, and there are side effects in a small amount of guys. Women should avoid taking Finasteride because it's basically for guys. If you're trying to become pregnant, it can cause problems, even just touching one of the pills. So if your husband or partner take Finasteride, make sure you don't touch the pills or go anywhere near them. Just reading more about it, it's normal for women to lose 50 to 100 hairs each day. Those with female pattern baldness will lose a lot more. Like I said before, if you start experiencing baldness over a very short period of time, then definitely see your doctor, because it could be something completely different. Yeah, I found another website I was just reading. The first one was a British website. This one I think is an American one. Women are less likely to develop female pattern baldness before midlife. Like men, they are more likely to start losing hair once they get into their 40s, 50s and beyond. There's laser combs and helmets are FDA approved, that's the American approval system, to treat hair loss. They use light energy to stimulate hair regrowth. More research needs to be done to determine if this is truly effective. If low iron is contributing to your hair loss, your doctor may prescribe an iron supplement. At this time, there isn't any evidence that taking iron will regrow your hair. Other supplements such as biotin and folic acid are also promoted to thicken hair. One study did show that women develop thicker hair after taking omega-3 fatty acids, omega-6 fatty acids and antioxidants. However, it's best to check with your doctor before taking any supplements. Yeah, there's a thing called traction alopecia. This hair loss occurs when a person frequently wears hairstyles that pull the hair too tightly. So if you're tying your hair back each day, don't do it as tightly, because doing that, and I've seen people who've done this, their hair is so tightly pulled back that it does start falling out. Certain medications, such as those that are used to treat cancer, can cause hair loss. However, the hair usually regrows once a person has stopped taking the medication. There's an autoimmune disease. Alopecia areata is a rare autoimmune disorder that causes the immune system to attack the hair follicles, leading to hair loss. Illness. Hair loss can develop after a significant illness, such as a severe infection, high fever or surgery. Again, this website mentions minoxidil, oral medication. One of the most common oral medications used to treat female pattern hair loss is spironolactone, which is a diuretic. Diuretics remove excess water from the body. This may also block production of androgen, which may prevent hair loss and help hair regrowth. It can also cause side effects such as dry mouth, nausea and dizziness. Women who are pregnant, again, should not take spironolactone due to the possibility it might cause congenital disabilities. The other thing I've read about is that people with male pattern baldness, it's sort of certain areas, whereas with women it can sort of be all over the baldness starts appearing. Consider the following hair care tips. Limit treatments that can lead to hair damage, such as perming, straightening and hair extensions. Again, I try and use a hairdryer as little as possible now, because I don't think it does you that much good. Eat a diet rich in protein, essential vitamins and iron. Protect the hair from sun damage by wearing a hat. Avoid brushing the hair when it's wet and fragile. Use a comb or your fingers instead. Female pattern baldness can be distressing and affect a person's self-confidence and self-image. Women who experience excessive hair loss should talk with their doctor or a dermatologist who can help determine the cause and best treatment available. Early diagnosis can help a person develop a treatment plan that prevents future hair loss. Treatments are available that may help restore hair growth. The effectiveness may vary depending on the treatment selected and the amount of hair loss. So it's pretty similar to guys from what I've read, but the baldness happens slightly different times, or it can do in life, but the treatments are pretty similar. So you can camouflage it using fibres. I've done another video on fibres which you can watch, and I put them on myself so you can see just how great they are. I'll leave a link below in my Amazon page as to what fibres I used to use. But yeah, I'd suggest using a healthy diet. I take biotin. This makes your nails and hair grow quicker and stronger. I know this because my nails, literally, you need to cut them twice as often as what I used to before taking biotin. I take saw palmetto, which is supposed to be a herbal version of Finasteride. Like I said before, females shouldn't take Finasteride, and even saw palmetto, I'd consult a doctor before taking that, because it's also used for prostate problems in guys. But yeah, biotin. I take turmeric in my coffee now, just to put a little bit of turmeric in, which is an antioxidant, which is also good. I've also started taking the omega-3s. So this is the biotin that I take, and I'll, as usual, put a link to it below in the Amazon page. This one's 10,000 mcg. Take one of those every day, and yeah, like I said, they make your nails grow quicker. Omega-3 fish oils, they're 1000 mg. Take one of those a day. They're supposed to be good for your hair. Multivitamins, anyone will do really, but try and get ones for vitamins A, B, C, D and E. Take those once a day. I've taken multivitamins for years. The turmeric I mentioned, I just got from Tesco's, just the, basically I think it was 85p. Just put a little bit of that in with my coffee. It makes it taste a little bit fiery. It's, I think, what they use in curry to make the curry colour. The other thing I take is Alopecia. Don't get this muddled up with Alopecia, which is Finasteride. Alopecia contains saw palmetto, ginkgo biloba, biotin. It's kind of like an all-round hair vitamin pill for you. It's really good. They don't really sell it in the UK, so I bought these when I was in Turkey getting my hair transplant. Bought about 6 months worth out there because it's a lot cheaper out there. You can get them on eBay, but they're quite expensive because you have to basically pay the postage to get them sent over from Turkey. These are the guys' ones with the blue box. The female ones have like a pink bit around there, and I guess they contain slightly different things. I don't know if they contain the saw palmetto, but yeah, they're a good all-round hair pill to take. I've got a couple of months left of those. Afterwards I'm just going to stick with the biotin and saw palmetto, which I take. I think that's about it really. If you want to see my before and after pictures, people always moan that I don't put before and after pictures on every single video I do. Check out some of my other videos. There's, I've put before and after pictures on those, and during pictures during the op. If you've got any questions, let me know. Like I said, I'm not a doctor or a healthcare professional or anything. I'm just someone who's had the hair transplant. The stuff today was what I was reading of articles. I found medical articles on the internet. If you Google female pattern hair loss or female hair transplant, you'll be able to come up with the same articles. There are a lot more, like I said, females getting hair transplants now. They don't like to talk about it quite as much, but the people who've sent me messages have been happy with their results that they've been getting. Some of them have been to the same hospital that I went to, I think, and yeah, they've been doing really well from it, and it restores their confidence. A lot of them said that they just want maybe the edges tidied up, sort of made slightly thicker, or certain areas of the hair. And if you watch my first video, that goes into great detail on my first hair transplant video. That goes into real great detail for literally an hour about the whole process, what you do, where you go out there. You basically book a package, mine was 2 nights. You fly out to Turkey, everything's included in the package. Hotel, transfers from the airport, transfers from the hotel up to the hospital and back. The only thing that's not included is your evening meals at the hotel you pay for, which the food out there is really cheap, and your flights, so you have to pay for your flights. I was out there 2 days, flew out on the Sunday, had the op done on the Monday, flew home, had an aftercare appointment on the Tuesday morning, flew home Tuesday afternoon. It's fine, they give you a WhatsApp number, you can video chat with them, or you can just WhatsApp them and talk to them if you're unsure about anything. And they like you to send photos of how well it's going sort of once a month. I still stay in touch with my clinic now, they're really good. They, literally you can just talk to them on WhatsApp if you've got any questions at all. But yeah, any questions, leave in the comments section below, or find me on Instagram, which again is linked in the bio below. And then you can private message me if you need to private message me about anything. But yeah, good luck if you are going to have it, male or female, good luck to you. As long as you pick a reputable clinic, you should be fine. It's, I'm not going to go into too much detail on the hair transplant because I've made other videos and you can watch those if you want. They go into great detail. But I just thought I'd make a quick one about female pattern hair loss because I've been reading quite a lot about it recently. Alright, cheers.